Hello, everyone, and this is Douglas Tarrin. I'm the director of the Public Health Training Center here at the University of Arizona, Mellon Zuckerman College of Public Health. I want to welcome you to this fourth webinar in our series on successful nutrition programs on native lands. And today we will be presenting promising practices in nutrition and diabetes prevention and management about the special diabetes program for Indians that is happening in Tucson, Arizona. Now I figure out how to change the next slide. Okay. So this presentation is being provided by the Western Region Public Health Training Center. Our training center is funded by HRSA, and it serves the workforce, the public health workforce in Arizona, California, Hawaii, Nevada, and the U.S. Associated Pacific Islands. And we're also pleased to partner with the Southwest Telehealth Resource Center here at the University of Arizona College of Medicine 2, which also serves the Southwest in the state that you can see on the website. And it's with them that we're able to actually provide this as a webinar and get this out to everyone. Oops.
Need to be frozen. There we go.
No, it's clicking right. Oh, no, I'm all messed up here. Okay. Sorry about that, everyone. Just a moment. Okay, the next thing I just want to tell you all is that this webinar is approved for continuing education credits for 1 point contact hours for nurses, that's the CNE, for the health education specialists, and for dietitians. And as far as the continuing education units for nursing, we have developed specific learning objectives that you can see here, which is to, at the end of this webinar, you'll be able to discuss the diabetes programs here in the Tucson area. You'll be able to describe the successful activities that are occurring on the Tohono O'odham Nation's diabetes program, identify resources available to all diabetes programs, and then discuss how to implement these tools in various settings and hopefully in your own settings. The planners and presenters have no relevant financial relationship to disclose. And in order to receive your continuing education units, you have to have attendance here for the whole time. You must be present for the duration. You have to complete an online evaluation at the end. And this evaluation is available at the website listed, cne.nursing.arizona.edu. And you can get your 1 credit unit. Here's just some tips for participating in the webinar today. Please mute your phone and or computer microphone. That will help prevent some feedback. The time is reserved at the end for questions and answers, and you'll be able to type in questions to us that we'll be able to reply to at the end. At the end of the webinar and after the questions and answers, please fill out the post-webinar survey, and this helps us always improve the webinars that we provide. And this webinar is being recorded, and you'll be able to get access to it afterwards, and for CNEs if you know of others who want to get CNEs by coming back and looking at the recorded webinar. And the recording can be obtained through both the Southwest Telehealth Resource Center at their website and at the Western Region Public Health Training Center's website. So it's my honor to introduce today's speaker, Lieutenant Commander Dolores Addison. She's a public health nutritionist for the Tohono O'odham Nation. healthcare. I just want to say one thing before I give you a little bit more about her. I'm really pleased to introduce her because when I started my public health career, I was a WIC nutritionist for the Navajo Nation, and I really learned about public health from the public health nutritionists that were working in Tuba City. And so I have a long, endearing recognition and appreciation of public health nutritionists. Before the position she had at Tona Otham, she was an Indian Health Service in the Tucson area diabetes consultant. And she worked with the three special programs and special diabetes programs grantees in the Tucson area. So she has lots of experience, not just with one group, but with multiple groups. She has spent the majority of her career as a dietitian working with the Indian health care system in tribal and federal entities. Dolores graduated with a bachelor's degree in nutritional sciences from the University of Arizona in 2003 and completed her dietetic internship through the University of Incarnate World in San Antonio in 2004. She received her Master's of Public Health degree from the University of North Carolina at Chapel Hill in 2013, with an emphasis on leadership and program development. In addition to diabetes prevention and management, Dolores has a deep interest in weight management and has completed the Commission on Dietetic Registration Level 1 and 2 certificates in adult weight management and the certificate in childhood and adolescent weight management. So with that, I'm pleased to turn the mic over and the program over to Dolores.
Thank you very much, Doug. And I want to send a great thank you to the Training Center for allowing me this opportunity to present to you all about our great programs in the Tucson area. We're the smallest area in IHS. So that's given me, in my time as diabetes consultant, a really unique opportunity to work very closely with our three programs. So I'm very grateful to be able to share at least a little bit of what we've done with the programs, or I should say what the programs have done for their communities. I should point out, though, just a couple of things before we get started. First off, I'm not used to speaking into a camera, but I'll also be looking down at my notes as well. I brought some notes to make sure I'm as prepared as I could be. Also, since we started talking about this presentation, a lot has actually changed for the Tucson area IHS. The self-service unit is now under management of the Tohono O'odham Nation. So we are now Tohono O'odham Nation Healthcare. And with the transition, my position has moved to be the public health nutritionist for TON Healthcare. So it's a new position for me as of July 1st. I am very excited with this endeavor. I also, like Doug said, hold a great level of respect for public health nutritionists who are out in the field and really working with communities directly. It's hard work, so I am looking forward to it. I'm also almost 38 weeks pregnant, so I'm happy I'm still pregnant. I didn't have to postpone the presentation. So anyway, we'll go ahead and get started. Because of my new position with TON Healthcare, most of the information I'm going to be highlighting is going to be from the Tohono O'odham Nation Diabetes Program, but I will be highlighting a couple of the things that our other programs, Basco Yaqui Tribe and the Tucson Indian Center have done as well. All right, work. So the objectives, as they were already mentioned, is just to discuss the diabetes programs in the Tucson area, describe some of the successful nutrition-related activities of these programs, specifically those at TO Nation. I can talk about these programs for hours and hours and hours, specifically related to the nutrition activities that they do. But I went ahead and highlighted some of the bigger projects that they have. Identify resources available to all diabetes programs. If you are part of the SDPI grants, you're probably well aware of some of the resources I'm going to provide. But just in case there's somebody else out there who is looking for more resources, I think it's important to point them out. And then discuss how to implement these tools in different settings. So just a little bit of a background on SDPI. I know you've already heard this before, so I'm going to keep it quick. But SDPI was established by Congress in 1997 to provide funds for diabetes prevention and management. Grants were given to 301 IHS tribal and urban Indian health programs in 35 states, and 3 are in the Tucson area. The funding has supported quality diabetes treatment and prevention programs and has resulted in some very promising outcomes. These are some of the most recent outcomes that are published in the latest report to Congress. Increases in diabetes prevalence are slowing, diabetes prevalence in youth is not increasing, and the incidence rate of end-stage renal disease and diabetes is decreasing significantly for American Indians and Alaska Natives, and that's kind of the opposite of what's going on when you look at other ethnic groups. If you'd like to take a closer look at the report to Congress, you can find it on the Division of Diabetes Treatment and Prevention website at the link below. Okay, so now to talk a little bit about diabetes in the Tucson area for Alaska Natives and American Indians. While we are seeing promising outcomes across the country, the Tucson area tribal communities are seeing slower progress, and there's still definitely a struggle with diabetes. Prevalence rates in the Tucson area are about 19% compared to 9.3% in all the US population. On type 2 diabetes in children, while it's still at very low rates, it continues to be a concern, especially as we see very elevated obesity rates in children. With regard to obesity rates, we know that for the Tucson area, about 40% of adults have a BMI over 30, and 26% of children have a BMI over the 95th percentile. And I believe it's about 70% of children have a BMI over the 85th percentile. And this is according to the 2014 GIPRA results. So now I'll provide a brief background on the 3 SDPI programs in the Tucson area. These include the Tohono Nation Healthy Autumn Promotion Program, the Pasco Yaqui Tribe Diabetes Prevention and Treatment Program, and the Tucson Indian Center's Diabetes Program. So the Tohono Nation is comprised of 4 land bases across southern and central Arizona, the largest of the bases consisting of more than 2.7 million acres. Traditional lands span across the U.S.-Mexico border to Puerto Peñasco, Sonora, or also known as Rocky Point around here. The nation's SDPI program, Healthy Autumn Promotion Program, or HOP, provides diabetes prevention and management services, education, and activities across the entire reservation. Wellness centers, group education, community wellness events, and school health education are all part of what HOP offers to its communities. So this is a group, as with all SDPI programs, the staff that run these programs are extremely busy. They do a lot of traveling, especially here in southern Arizona, and they're really good at what they do. These are just some pictures that exemplify a little bit of the Tohono Nation. And next, the Pasco Yaqui tribe consists of a reservation of about 202 acres and 4 urban communities located in Tucson, South Tucson, Marana, and Guadalupe, Arizona. Pasco Yaqui also have strong ties to their Yaqui relatives in southern Sonora. Health services are provided by contract through a Rio Community Health Center. However, the tribe has been working very actively to provide services on the reservation and have successfully opened up several services to members on tribal lands, including alternative medicine program, a primary care clinic, dialysis services, and a dental program. And the Pasco Yaqui Diabetes Treatment and Prevention Program also provides services across all their communities. In most recent years, they have had a lot of success in their physical fitness services and have helped tribal members reach activity goals through activities such as boxing, swimming, distance cycling, and powerlifting. During the Tour de Tucson, there's always a huge representation from the Pascoyaqui tribe, and I think that's awesome. And here are some images that depict the Pascoyaqui tribe as well. Finally, the Tucson Indian Center, which is located in downtown Tucson, has a thriving diabetes program as well. And it offers services to its over 900 members and community members throughout public wellness events, nutrition and fitness education, and one-to-one education. Although the program is one of the smaller ones of the three in the Tucson area, they're a very active program as well, and very busy as well. And I know that their participants are very appreciative of the staff there. Recently, the Tucson Indian Center has moved locations. They're now located off of Stone Avenue in Tucson. There's a picture of the new building there. We also have pictures of some of their participants that are part of the walking club and some of the other programs involved. Okay, so now we'll go ahead and start the discussion of nutrition programs. And I first wanted to talk about a program that both Pascoyaqui and Tucson Indian Center participate in, and it's the University of Arizona Garden Kitchen. They have partnered with the Garden Kitchen to do cooking demonstrations, I believe, on a monthly basis for both programs. And it's actually been extremely successful for both programs. Very well attended classes. Usually the monthly classes are provided as part of an additional program. For example, at Tucson Indian Center, they are provided as part of the group lifestyle balance curriculum. So usually the programs will, they'll have their GLB class and then they'll have a cooking demonstration after that. At the Pascoyaqui Center, it's offered to all community members, including tribal staff. So it's usually done at lunchtime, and again, very well participated programs. These cooking demos not only provide an opportunity for participants to taste some nutrient-dense meals that maybe they haven't, and some ingredients that maybe they haven't used ever, but actually gives them an opportunity to prepare them as well. So they're learning cooking techniques, which is very important when we're talking about establishing healthier lifestyles. As I mentioned, these are well-attended events, 20 to 30 attendees every month. Which may not sound like a lot to some people, but it actually is quite a bit for a program, a regularly scheduled program, to constantly have at least 30 participants attend. And everyone gets an opportunity to cook and taste the delicious food. I've been able to be a part of a couple of these cooking demos, and I'm always so impressed at how, not just the presenter, but how involved and engaged all the participants are as well. So the next program I want to talk about is diabetes education in tribal schools. Now this is something that the Tohono O'odham Nation started 7 years ago. It's a curriculum that was created by IHS, and the lessons are provided to school children at BIE schools on the Tohono O'odham Reservation, and I'll go ahead and talk about that a little later in the next slide. Some of the lessons provided to school children include the effect of diabetes in tribal communities, making healthy lifestyle choices, including healthy eating. The curriculum incorporates national science education standards, and it matches up with Common Core standards as well. So these are well thought out lessons that for the Tohono Nation have been very successful. It starts with a pre-assessment for all the children. So they take a pre-test, basically, assessing their knowledge of diabetes. They also go through a fitness test and height and weight measurements. And at the end of the school year, these are done. There's a post-test assessment, the fitness test, and height and weight measurements as well. So they can compare, you know, how effective the learning was for the children. So for TO Nation, for HOP, I should say, they're in their 7th year in the Bureau of Indian Education Schools. And unfortunately, I wasn't able to get any numbers, any of the outcomes that they have, any of the data by the time I had to submit my presentation. But we do know that there have been significant decreases in overweight and obesity rates for the children who have participated in DETS over the years, especially those who have participated over the past 7 years. They've been able to sustain healthier eating habits in the home and outside of the home, such as decreased intake of sweetened beverages, decreased portions. There's a very strong support from the school system, the community, and the children. There's been lots of really positive stories about DETS on the Tohono Nation, and I'm so happy to hear how effective it's been, not just for the children, but for the families as well. I recently heard a story from an instructor about a parent, I think it was a parent or a grandparent or something, that was serving their child a glass of soda. This was probably a 1st or 2nd grader, and the little kid goes, "Why are you serving me diabetes?" So they're getting it. They're getting the connection between certain, you know, an increased intake of certain foods, an increased lifestyle, you know, sedentary lifestyle, and the risk of diabetes, and at a very young age as well. So it's been very promising to see how successful DETS has been in the on the reservation. I actually just started a DETS class for the San Javier after-school program for some 5th and 6th graders. It's a small group of kids, but we thought it would be, since there isn't a DETS group on the San Javier district, we thought it would be great to try it out with these kids, and it's actually been very successful. We just started, but the kids are really they're really getting the lessons, and they're very insightful, and they're providing a lot of education to me about what sort of things are affecting their abilities to stay healthy and be healthy, and it goes beyond nutrition and physical activity. So that was very surprising to me to hear. So I've, you know, in the couple months that I've been doing it, I'm very impressed as well with DETS. So the curriculum is available for free on the IHS website, and this is the link to that. It's also available on the Division of Diabetes Treatment and Prevention website. You'll get the kit. You can order the kit online, and you'll get it for free. It's an excellent curriculum. Next, I wanted to discuss the lifestyle balance curricula. There are several versions available of lifestyle balance, but all of them derive from the Diabetes Prevention Lifestyle Balance curriculum, the DPP study that was done several years ago. The different versions available include group lifestyle balance, what we implemented in Tucson, and that is provided by the University of Pittsburgh. There's a version provided by the YMCA, and most recently a version offered by the CDC, which I'll go ahead and discuss a little later. At the time we started offering GLB in the Tucson area, GLB was what made the most sense for us after doing some pilot runs with other programs. So GLB promotes a modest weight loss through healthy eating, physical activity, and behavior modifications, just like the other ones do. And the curriculum includes 12 core and 10 post-course sessions. And after playing around with shorter spans of lessons and longer spans of lessons, for us at the time, 12 lessons seemed to be the key number. It's when we had the most participation, as opposed to, I think we tried 8 lessons, and then we also tried 16. But this made the most sense for us at the time. Just a little side note on DPP in case you are not aware of it. As I mentioned, several years ago in the 90s, the DPP was funded by NIH and was conducted in 27 centers across the country, including American Indian communities in the Southwest. Participants were randomly assigned to one of 3 arms of the study, either intensive lifestyle intervention, the metformin group, or a placebo. With regard to the lifestyle intervention, the goal was to reduce fat and calorie intake, increasing and maintaining physical activity to at least 150 minutes per week, and obtain at least a 7% reduction in baseline weight. At the end of the study, well, not at the end, they actually had to cut it early because the lifestyle intervention was so successful. This arm of the study group saw a 58% reduction in risk of diabetes, which is amazing. And the even more amazing part was, as part of the DPPOS, the outcome study that was done, I believe, 10 years later, there was still a significant reduction in risk for the patients who were part of the lifestyle intervention group. So not only did it help in the short term, but the lifestyle intervention has helped in the long term as well for these participants. So that's very significant. So a little bit again about the GLB curriculum. The 12-week sessions cover basic principles of nutrition, physical activity, and behavioral modification, which I believe is extremely important. And we don't always think about the importance of behavioral modification. Food and activity tracking is encouraged throughout the curriculum, and the patient's weight status is tracked on a weekly basis. The 10 support sessions expand on what the core sessions taught. These are usually taught on a monthly basis and not on a weekly basis like the core sessions. And these include topics such as resistance training, stress management, and mindful eating. In Tucson, we conducted GLB core sessions at Santa Vera Clinic as a test. A small group of us attended training at the University of Pittsburgh, and we saw continued success at Santa Vera Clinic. So in March of 2013, I hosted a training in Tucson. We brought the GLB instructors to Tucson, and were able to train 45 people from IHS, Tucson, and Phoenix area tribes, our Urban Indian program, and other county partners. So it's a very successful training. It was much less expensive to bring the trainers to Tucson than to have 45 people go to the University of Pittsburgh and train. So and we saw a lot of success with this, and we're still seeing programs participate in group lifestyle balance. There definitely are some challenges implementing this sort of program. One of the things that I experienced when we started in the clinic was staff enthusiasm. We had maybe 1 or 2 providers that were referring patients to us, but not really too many more people. And I think that's just part of what happens when something new is introduced to a clinical setting, or to any setting really. So it was important for us to make sure that we not only marketed the program well to patients so that they tell their providers about the new program, but also that we marketed it to providers, specifically at Sanavir Clinic. We were also using EHR, electronic health record, to send communications to providers pretty consistently to let them know, hey, we have GLB going on. Please let us know if you have any patients that are interested. We'll talk to them. We'll get them ready for classes. And that seemed to work for us. Administrative and financial support can also be a challenge for some programs. The cost of providing group lifestyle balance is minimal. It seriously is. The cost of the handouts and a few incentives is basically what we spent. And incentives being measuring cups and spoons, little things like that are actually awesome incentives that that most of our patients will be using once they get them home. But for some programs, it might be an issue. So it's important also to keep open communication for those people who are in charge of making these decisions as well. Finally, some other challenges include competing programs. So a lot of times what you see in community programs, and I'm sure some of you are well aware of it, is that we have a lot of the same people going to a lot of different events and a lot of different activities. So when there's a new program out there, it might be a little challenging at first not to recruit and retain participants. And in that situation, I think it's really important to partner up with other programs, with other activities going on, so that you're not competing for the same people. In addition to that, again, you want to make sure that you market your new activities as much as possible. Use all your resources that you can, so that more people are aware of the new program, and may get some new people who are just looking for exactly this sort of program, who otherwise wouldn't know about it if it wasn't, for example, announced on the radio station, or a poster was put out at the convenience store or something like that. Just a little bit about the outcomes for Sanavir. These were part of the these are part of the participants that participated in 2012 and 2013. I wasn't able to, unfortunately, collect weight change data from the tribal and urban Indian programs, but these represent basically patients who completed at least 25% of the course session, so not even the entire 12 sessions. So as you can see, we definitely saw some great results for a lot of our patients that participated. In addition, many of the participants have expressed positive impact the GLB classes have had on their families. Reduced intake of sweetened beverages and other energy-dense foods, increased meals prepared at home instead of eating out, and increased family activity have all been reported by our participants. I remember one patient I had specifically who had to stop going to the classes because she had to start working. So she got through half of the classes, came back maybe 6 or 7 months later, and complete 180 for her family. They weren't drinking soda anymore at home. They were going to the park every day to play. They've all had lost some weight, which all needed to lose some weight, and just overall a much, much healthier, happier family. So it just goes to show that if we can get our participants to attend even a quarter of the classes, we're seeing some awesome results. These are just some information about what instructors say about group lifestyle balance. Most of them have found it to be a helpful tool in helping their participants live healthier and lose weight. For example, participants are excited to learn about nutrition and healthy eating for themselves and family. It's great to see clients achieve goals, learn to control blood glucose, improve other lab values, and even reduce or completely stop medications because of their weight loss. This encourages me. So it was really great to see that from staff. Our staff are saying that this is what we like about GLB. Some challenges that instructors identified include recruitment and retention of participants. Having participants use and turn in the tracking logs is very difficult. Probably one of the more difficult things. One of the most effective things that you can do for weight loss and behavior modification, but very difficult to attain. Some clients lose interest quickly after seeing a week of weight gain. Transportation to weekly classes can be an issue. Finding a time that works for all the clients, less excitement from the community, and then keeping people motivated. These are all some of the challenges that our staff had noted. Some of the things that they did to overcome these challenges include food demos and taste testing at weekly classes, teaching different exercise routines or incorporating physical activity at each class. We had one group incorporate a walking club with their group lifestyle balance class, and that was very effective for their small community. Partner with community programs like universities, the Garden Kitchen, for example, to offer additional education at sessions. There's also programs like the Nike Native Fitness program that can help provide awesome incentives for your participants to keep them coming. So currently, with regard to lifestyle balance, the TO Cells Hospital Diabetes Prevention Program has applied for pending recognition status under the CDC Diabetes Prevention Recognition Program. They'll be using the CDC Lifestyle Balance version of the curriculum, which is called Prevent T2, and it's available on the CDC website. HOP may also look into this option in the future. So we're evolving when it comes to our lifestyle balance curricula or diabetes prevention curricula, but I think it's important to note that we're looking towards improvement. We're looking towards, getting that recognition status, and I think that is definitely going to be the wave of the future. Soon, the very near future, actually. Finally, I wanted to talk a little bit about another program that the Tohono Nation HOP will be participating in, which is called the Family Spirit Program. Some of you with SDPI probably have heard about this program. There was a presentation several months ago from the folks at Family Spirit showing their promising practices with the program. But basically, what it is a comprehensive program which includes nutrition education, but spans across several different important topics, including things like birth control, financial management, and stress management. All very, very important topics that need to be addressed, especially for our young families. It's a home visiting program created by Johns Hopkins Center for American Indian Health to promote optimal health and well-being for parents and their children. It uses community-based workers to support young parents from pregnancy to 3 years postpartum. So this isn't a short program. These participants are making a 3+ year commitment to being a part of Family Spirit. And as part of that commitment, they're going to receive education on prenatal care, infant care, your growing child, toddler care, my family me, and healthy living. So it's a vast amount of education that these participants are going to be receiving. These families are going to be receiving. It includes the mother, the father, anyone in the household who is part of raising the child is going to be a part of the Family Spirit program. So we're really looking forward to that. For TO Nation, we're hoping it's going to be a joint effort between our clinical services and HOP and other programs as well. So I'm very, very excited to see that come to fruition soon. Now, to talk a little bit about the resources available to everyone, really, I wanted to talk a little bit about the Division of Diabetes Treatment and Prevention website, where you can receive several curricula and resources available absolutely for free. There are some downloadable and print options available to you. Also, things that you can order. For example, the DETS curricula is one of the things I mentioned. The image in the middle of the slide, my native plate, it's a big placemat-sized poster of my native plate, and it's actually a very effective tool. And you can order those in packs of, I believe, 50 through the website. And you can also download the picture as well if you wanted to go ahead and do that. And we have some programs that you know, they laminate it for their participants, so it doesn't get soiled at all. These are great handouts, and they're usually very, very popular. This is just a screenshot of the Division of Diabetes Treatment and Prevention website. It's actually changed a little bit since I created this slide, but you'll still find all the great information on there. And here is, for example, how you can find the online catalog information. You can search by audience, by topic, and by format. So you have lots of different options to search whatever it is that you're looking for. So finally, when we're talking about implementing these tools in your settings, here are some things that I've learned in my 12 or so years working within the Indian health system. Support from partners is going to be key for long-term support, or for long-term sustainability. You want to be able to partner with different programs that may have similar missions, similar values. That's going to be really important for your program to continue sustainability. You want to use materials that can be modified to best fit the needs of your community. Every community is different. So you want to enhance any curriculum, any activity that you do with things that are culturally relevant to your community. That's extremely important, I think. Communicating with your partners is going to be very important for success as well. So regularly scheduled meetings to talk about whatever program you guys are working on together, that sort of thing. And it's very important to find a curriculum that works for you, for your community or organization. So take the time to do some research. There is a lot out there. There are a lot of resources out there, and one may work for you and one may not work for you. So it's important to do the research and figure out what's going to work best for your community. Finally, my last objective was to discuss how to implement these tools in various settings, but it's not easy to do that because, like I said, every community is different. So I completely understand if in my evaluation you dig me for that, but what I can share with you is what working with Native communities has taught me over the past 12 years. And I feel that these are true for just about any community, and are very important when you're considering implementation of any different program or activity for your community. First, communities are resilient. Many communities we work with have been victims of economic downfalls, oppression, trauma, and other negative occurrences. But with the right support, they bounce back from these plights. It's not one program that comes and changes the community. It's the community itself that makes a decision to be better, to heal itself, and we need to remember that. Communities have resources. Communities have several resources to continue programs when the money runs out or when a grant program ends. So we need to make sure that those that stay behind know how to access these resources and are going to be able to continue and grow the good work that they have started. One of the most important things is that communities have champions. Sometimes they're hiding in the crowd, but communities have people who are willing and able to learn and lead. And it's important for our programs to seek out those champions and to have them be a part of your program. Involving the entire family is absolutely key. Because if you teach the child but not the parent, or vice versa, somewhere in the process the message is going to get lost. So make sure that as many family members as possible are part of the learning process. Children have to be involved. They have to be a part of the learning, even as early as in the womb, as we see with the Family Spirit program. So the earlier, the better. And finally, communities want positive change, and they deserve to make an opportunity to. They deserve an opportunity to make these changes. So, again, it's hard to identify specific things that'll work for implementing different programs within your communities. But if we remember these key things, I think we can really, within your groups, you can really find what's going to work best for your community. And I hope that the information that I've been able to provide to you today has been helpful. I did notice that I did not include my email address on my slide presentation, but I'll be happy to answer any questions now and provide my email address later for any questions in the future that you may have. So thank you very much.
Thank you, Dolores. And yes, we do have questions provided to us. The first question is, what kind of tools were used for the food and activity tracking you did in the Lifestyle Balance program?
So the group Lifestyle Balance program had a, it was a very small, gosh, maybe 4x6 booklet, a weekly booklet that we actually printed out. We got the template for it and we printed out for our participants. That included 7 days, room for 7 days worth of tracking, both physical activity and nutrition. We would give them one every week at the beginning of the class, and they would turn in their activity tracker. For some participants who are a little more tech savvy, we did encourage them to use different apps that do food tracking, such as MyFitnessPal and Lose It. Super Tracker is another one that we encourage participants to use if that worked better for them, and some of them definitely did it. Everybody, it seemed like, was very different. So
just a little plug for the Western Region Public Health Training Center. We will have a training coming out pretty soon in the spring about different apps that are used for tracking diet and physical activity. So people can talk to patients and clients about how to use the apps and what are the advantages of different types of apps. And we're focusing on 4 of them. I don't forget the exact brands now, but please look for that. Another question we have is, can you talk more about the Prevent T2 curriculum?
yes.
And specifically, has that been updated with sort of the current research, especially around dietary fat and any other recent changes? And there's a follow-up question to that, but I'll let you do that.
Sure. I haven't been able to do too much research on the Prevent 2T at this point, but I do know that it is one of the most updated versions of Lifestyle Balance curricula out there, and because it's part of the CDC, I assume that they are going to have a team that's going to be updating the curriculum pretty frequently. That's another kind of challenge when it comes to some of these curricula, is that there isn't a team that's updating them as research comes out. For example, the Native Lifestyle Balance program hasn't been, I think, updated since 2008. Group Lifestyle Balance hasn't been updated since, I believe, 2012. So I believe the CDC curriculum has been updated up to 2014 information. So it is the most recent out there. It's also free. And it's available to be downloaded on the website.
Can you tell us a little bit more about the training that was done for those who helped implement it, the staff training, how comfortable they were with the training and actually providing the curriculum themselves?
Sure. So as I mentioned, we brought the University of Pittsburgh instructors to Tucson in order to provide some of the training. They're great instructors. I think one of the challenges is that, you know, the training was geared towards healthcare professionals, and we had a lot of lay health workers that provide the curriculum. So we needed to make sure to let the instructors know that, so that not only were they providing the information needed for, you know, continuing education, but that they were also providing tools and opportunities for the community health workers, the lay health workers, to do a little bit of active role playing during the sessions and that sort of thing. So I think it went well. I made sure to make myself available to the staff after the training if they had any questions that came up. And a lot of them took advantage of that. So I think it is important, if you are thinking about doing a kind of a big training like that, that you're going to have some key people available to answer questions after the training and support your staff.
So another question is about the behavioral changes that are going on in these programs. You gave some great information about weight loss over periods of time. Are there certain behaviors you think are changing and being maintained longer than other types of behaviors? Or if someone's going to like really focus on what behaviors do we think we can be most successful at? Can you give some recommendations on that?
Yeah, that's a good question. I think what I saw with the groups that I was working with is we really made sure to keep it as individualized as possible. There wasn't one behavior modification, I think, that was successful for absolutely everyone, and the answer to all of our questions. You know, I think it's really important to let the patient make the decision on what behavior change is going to work, what behavior change they're ready to make at that moment, as opposed to suggesting you should do this, or this. At least that's what I've seen within my practice and within the classes that I provided, is that we really wanted to make sure that the patient was holding the reins, and they're the ones who led the who led their own journey towards healthier living. So for some, it was very easy to make some nutrition changes immediately. You know, they were able to really make some very positive changes to how they were eating almost immediately. But they took a little longer when it came to consistent physical activity. For others, it was the opposite. For others, we had some people that really they really held on to the concept of having a support system. So they were able to talk to friends and family and tell them, this is what I want to do. I need your help doing it. And for some people, that was the very last thing that they were able to do. So it is really different for everyone. I think it's important to let your participants know that they're the ones who are leading this journey, and you're there to help them.
Can you talk a little bit more about, and maybe this is going to be our last question, about how you take materials, and do they have to be adapted for your for the different groups you work with, for Tohono, Pasqua, Yaqui? You're getting something from one program, but then you have to sort of make it so it's appropriate for your local community.
Yeah.
Could you give examples if that had to happen, or?
Yeah, we did. We didn't do as much of that within the clinical setting, but I know that some of our programs, they didn't necessarily change a lot of the lesson plans per se, but they included some culturally relevant material. Just a small example is a Donaldson food pyramid that was available for some GLB participants, and I believe participants in other programs. So what I notice is not necessarily that the the lesson plan was changed, but there were things that were incorporated in there that were specific to the culture. Discussions that were specific to the community, for example, inviting people from the wellness centers to come and do a demo, that sort of thing. So yeah, there wasn't any real major changes to the lesson. It was more incorporating things. Hope that answered the question.
Good. Well, thank you, everyone. We're going to finish up, and just want to tell you that this training series, again, that we're actually having another training. This is an in-person training. It will be held in Tucson, 3 trainings, 1 month apart, about improving indigenous public health systems on January 18, 19, the 15th, 16th, and March 29th and 30th. Below, you can come to the Public Health Training Center's website, wrphtc.arizona.edu, and you can register for this. Space is limited to 30 people. I believe we have just over 20 some now. And we'll be focusing the first workshop on policy development, the second workshop on program planning and evaluation, and the third workshop will be on budgeting. And we have people from the Navajo Alliance, Food Alliance, that help pass the Navajo junk food tax. We have the First Nations Development Institute from Denver coming down to talk about budgeting. And we have the San Javier Cooperative Farm coming to speak about how they look at developing metrics for outcomes. Again, for those who want your 1.0 contact hours for nursing continuing education, please go to CNE for continuing nursing education, cne.nursing.arizona.edu. And then in order to receive your certificate for health educators and for dietitians, please fill out this form within the next 7 days. That's before December 20th at https://arizona.co1qualtrics.com and all those other letters afterwards. You're able to get access to this website. I think maybe I'll just leave it up so you can write this all down for a moment. And then the other thing at the end of this presentation, there is a SurveyMonkey evaluation, and I'll show you the website for that next after you've written down this website. So this is the SurveyMonkey website /WRPHTC webinar. And once again, I want to thank our funding agencies, which are HRSA, 2 grants that we have, one for the Telehealth Resource Center, and then the one for our Public Health Training Center. And with that, this is the conclusion of the webinar. And once again, you can come to the Public Health Training Center website, wrphtc.arizona.edu, or the Telehealth Resource Center to obtain the archived files of this webinar, which will be available starting tomorrow. Thank you.